This morning in The Blend, we are joined by Dr. David J. Nebbeling with Advanced Osteopathic Health. Good to see you.
Yeah, thanks for having me.
Yeah.
So I understand that golfing injuries are pretty common, not just with the professional players, but with the casual players as well. Why is that?
So I think right off the bat, there can sometimes be this idea that golf is a sedentary sport, but what we really know is that it requires a fair amount of flexibility, strength, coordination, and obviously skill and technique. So for people like me who probably are better equipped to be driving a golf cart than a golf ball, we should really be giving this notion a second thought for our 1 or 2 excursions we'll have for charity events or what have you. But for those out there that actually know what they're doing, it all comes down to the golf swing. So this is a motion that's built from the ground up and involves a decent range of motion as well as rotation. And then, it's placing strain from the feet all the way up through the upper body. And then we have this strong, relatively explosive muscle contraction inherent to the golf swing.
Yeah.
And when we couple this to the repetitive nature of the sport, with admittedly some of us requiring a few more swings than others, then this is how stress and strain gets placed on the body.
Yeah. So what are the most common injuries that you encounter with golfers?
Yeah, so there's obviously a lot of them, but we see a lot of shoulder pain, so rotator cuff tears, pain on the inside or outside of the elbow, like golfer's elbow or tennis elbow, and obviously a lot of back pain too. And this is one where this could either be from the sport itself or simply aggravated by it. And then I think I'd also probably have to add knee problems because there's a decent amount of torque being placed on that joint.
Yeah.
And this is one that can definitely affect your game or just even limit your ability to walk the course comfortably.
Well, how can regenerative medicine help those injuries?
Yeah, so regenerative medicine is a non-surgical approach to healing ligaments, tendons, and cartilage, which are really the main components of joints. So we do this by stimulating the body's healing cascade with the end result of laying down new collagen fibers, with collagen being the fundamental structural element of joints. So this is typically an injection type technique like prolotherapy or PRP, which I think I mentioned before in a previous segment. That's what Tiger Woods had for his knee injuries. But the nice thing about it is that it is done in the office, same day, with no anesthesia, and it doesn't require the extensive downtime or the invasiveness of a surgical procedure. And really, these are the most important things for our golfers out there who just love the sport and don't want the season to get away from them this year.
I think it's good information, especially right now as we're heading out to the golf course. Doctor, thanks so much for joining us on The Blend. Advanced Osteopathic Health. You can visit them on the website right on your screen.